Hi, I'm Dr. Martina Hodgson and welcome to the Dental Architect YouTube channel. And today I want to talk about teeth whitening. So I love teeth whitening, and the reason I love it is because it is an affordable, minimally invasive, easy way to give patients an amazing smile glow up. So today I'm going to give you all the info you need to know about professional teeth whitening. So firstly, let's bust some myths. The first thing that I want to put out there is that if you're going to whiten your teeth, you need to do it with a dental professional. It is illegal for anyone who is not registered with the General Dental Council to provide teeth whitening to patients. So beauticians, nail technicians, etc. do not have access to the proper safe products and do not have the information they need to provide safe teeth whitening. And best case scenario, you're just not going to get a great result. Secondly, a lot of people think that teeth whitening can damage your enamel. Absolutely not. As dentists, nurses, hygienists, we all whiten our teeth. We love it, it makes our teeth look better, and it doesn't damage the enamel in any way, as long as you use a professional teeth whitening gel prescribed by your dentist. There's loads of over-the-counter products out there, which is fantastic, but to be honest with you, they're not going to be that effective. Worst case scenario, they are including ingredients in them such as acid that are stripping the staining off your teeth, but at the same time stripping the enamel, and so not particularly safe. So again, my advice is to always see a dental professional if you are looking at whitening your teeth. So there's two kinds of professional tooth whitening out there. One is the at-home whitening, where we provide you with some trays to wear at night and a bleaching gel. You do it at home. The second way is you come in surgery, it gets done in like an hour and a half with some kind of UV light, okay? So the studies have proven that the only effective way to whiten your teeth is with the at-home bleaching trays. There's no evidence that the in-surgery whitening has any kind of efficacy and certainly is not very long lasting. The best it does really is dehydrate your teeth, so they'll look really white at first, but as they rehydrate, the color will relapse quite quickly. So how do we do the at-home whitening? First thing we do is we take a scan of your teeth and we create these custom-made whitening trays. So we make them here at the Dental Architect in our own in-house lab, so we can turn them around really quickly for you, even the same day. Once your trays have been made, you'll have another appointment with either the dentist or the hygienist to have them fitted and check everything fits okay. We'll go through all the instructions with you and you'll be given a set of whitening gels. So these either contain carbamide peroxide or hydrogen peroxide. And what you'll do is before you go to bed at night, brush your teeth, then you will place the gel in the home whitening tray, pop it in, leave it in overnight, and then in the morning you just take it out, brush your teeth, and carry on with your day as normal. Now there are some gels that you can use daytime if you don't feel like you want to wear your retainers overnight, but for the most part, the overnight whitening is a really great and efficient, easy way to whiten your teeth. In terms of how long it will take to whiten your teeth, it really depends on where we're starting from. So some people may only need to do 3 or 4 nights of whitening, whereas some people may have really, really deep staining or other kinds of intrinsic staining inside the tooth that may take a lot longer to whiten. Your dentist is there to prescribe to you what you need to help you get the result that you need. So what are the downsides that we can expect from whitening? Well, the big one is sensitivity. Now, sensitivity is really common with teeth whitening, and it does depend and vary on individual to individual. So with younger patients, they have bigger nerves in their teeth, they're much more likely to get sensitivity than older patients. So sensitivity is something to be aware of. There are ways that you can overcome this. So you can use a sensitive toothpaste, you can sort of have one night on, one night off in terms of using it. You're not really going to know how sensitive you're going to be until you start treatment, but it's really rare that a patient isn't able to use our gel. We actually use a few different types of whitening gels, specifically selected to get the best result for the least sensitivity, but we're here to give you lots of advice on that. The other thing that you may want to be aware of when you're whitening your teeth is to avoid really staining foods and drinks. So anything that would stain a white t-shirt, such as red wine, berries, black coffee, curries, anything like that, try and avoid it when you're whitening your teeth, especially first thing on the morning, because when you wake up, your teeth will just be a little bit more porous and much more likely to pick up the stain. It doesn't mean you have to stop them forever. forever, but to get the best results, it is good to try and avoid these things that stain your teeth. So I hope that's answered most of your questions on teeth whitening. If you've got any other questions, please do put in the comments below.